The Delta variant of the SARS-CoV-2 virus is more contagious than other SARS-CoV-2 virus strains. Delta, a highly transmissible coronavirus variant, is now the dominant strain in the United States, the rest of the world, and is gaining traction. Delta, a highly contagious SARS-CoV-2 virus strain discovered in India in December, is currently a major concern. It then swept through that country, as well as Great Britain. The first Delta case was diagnosed in the United States in March, and it is now the dominant strain in the country. According to the most recent data from the Centers for Disease Control and Prevention, modeling shows that the variant now accounts for 83.2% of all new infections in the United States. What is the significance of the Delta variant? According to preliminary research, the Delta variant is approximately 50% more contagious than the Alpha variant, which was discovered in the United Kingdom and became the dominant variant in the United States during the spring. Experts predict that it will cause surges in communities with lower vaccination rates, posing the greatest risk to those who are older, sicker, and unvaccinated. Is the Delta version protected by the vaccine? The immunizations are effective against the Delta variety, and while infection is still possible, the vaccines greatly lower the risk of serious disease, hospitalization, and death. Is the Delta vaccine from COVID effective? Moderna and Pfizer's COVID vaccines are still effective against the Delta strain, according to the study. What makes the Delta variation unique? What is causing folks to be concerned? Delta is thought to be the most transmissible of the variants so far. It may also be able to evade the immune system's antibodies produced in the aftermath of a coronavirus infection or immunization. Although additional research is needed, Delta may induce more severe sickness. For the first time in more than a year, we have some hope or, at the very least, cautious optimism that the pandemic will fade into obscurity. However, experts warn that there is still a risk that new virus mutations will resurrect the virus and make it even more powerful. Do Delta infections cause different symptoms than other coronavirus variants? There has been little research on this, but some people have reported symptoms such as a headache, sore throat, and runny nose in the absence of the hallmark COVID-19 symptoms, such as loss of taste and smell. Will there be a need for booster shots? That is a debatable point. Although federal health officials do not recommend them at this time, at least one of the vaccine manufacturers has stated that it intends to seek approval for a booster shot. What else can people do to keep themselves safe? People who have not yet been vaccinated should continue to wear masks and make plans to get vaccinated as soon as possible, according to health experts. According to the doctors, the most important thing you can do to protect yourself from Delta is to get fully vaccinated. That means that if you receive a 2-dose vaccine, such as Pfizer or Moderna, you must receive both shots and then wait the recommended 2 weeks for those shots to take full effect. Whether or not you are immunized, it is critical to follow the CDC prevention guidelines, which are available online. Individuals with compromised immune systems should also practice social distancing, wear masks, and avoid crowds, particularly indoor crowds. Those things continue to apply to these extremely vulnerable people. Even better, an Israeli study found that the Pfizer vaccine prevented 90% of infections after both doses, even when new variants were present in the population. A decrease in infections also means that people are less likely to spread the virus to those around them. In the end, people must take precautions to protect themselves and their loved ones from the Delta variant. If you haven't had COVID, aren't vaccinated, and aren't wearing a mask, you're basically inviting Delta trouble. It will track you down. By far the most efficient form of the virus for finding hosts. If you haven't been immunized, a mask is essential right now. Other ways to help protect against the Delta variant for those who haven't been vaccinated yet, including those who aren't yet eligible, include wearing a mask over your nose and mouth while spending time with people from other households, particularly in poorly ventilated indoor spaces or crowded areas. Keeping 6 feet away from people who aren't family. Washing your hands regularly or using hand sanitizer when soap and water are unavailable. Avoiding crowded indoor spaces, including those with poor ventilation. Paying attention to local COVID-19 infection rates, including Delta variant rates, and avoiding unnecessary social contact with others when infection rates rise. Disclaimer: all of the content on this website is provided solely for educational and informational reasons. It is not meant to be a replacement for expert guidance. You do so at your own risk if you decide to act on any information on this website. While we have done our best to ensure that the material on this website is accurate, we cannot guarantee that there are no faults or inaccuracies. I invest a lot of time and effort into our program, and we're grateful for all of the likes, comments, and messages I received. Thank you for taking the time to watch my video and for your continued support. Please do subscribe to my channel, and we'll give 110% effort to improve more.